Hi, everybody. I'm Jocelyn Mamenta.
And I'm Vicki Veltri, Connecticut's healthcare advocate.
Well, Vicki, we're here to talk about why is insurance so important?
Well, insurance is important for a number of reasons. One, the most obvious one to me is security. I mean, you want to be secure for yourself, your family. You want to stay healthy. And frankly, medical bankruptcies are one of the biggest causes of bankruptcy in the United States. When you go without insurance, you're risking your financial health, your family's health. Also, what we're finding with people without insurance, when people go without insurance, they tend to frequent the emergency department. When you go to the emergency department, the costs are higher. Those costs get passed to everybody, and as a result, healthcare costs keep going up and up.
Right, and they don't take care of themselves either when they don't have health insurance.
There really is no incentive to really stay healthy, you know, when you don't have insurance. Having insurance, to me, is somewhat of a security blanket, but it's also a reminder of what it means to take care of yourself and be healthy.
So it's really a smart thing to do.
It's a very smart thing to do. As I always say to people, think of yourself as one, no matter where you are in life. If you're young and you think you're invincible, you could be on the ski slope. All it takes is one accident and your entire future could be changed. That's all it takes. And without health insurance, you could be stuck with medical bills that are catastrophic.
So how can somebody afford health insurance? Because it is expensive.
Health insurance can be expensive. I think thanks to the Affordable Care Act in 2014, it's going to make a huge dent in the affordability for a lot of people. One thing is, I should say, right now, if you're a young, healthy person, insurance is relatively cheap. If you're in about the 50 to 64-year-old range and you have pre-existing conditions, that's where things start to get a little tough. And the Affordable Care Act tries to do something about that by offsetting some of the costs for people buying policies by giving them some financial help to afford those policies.
Well, you know, a lot of young people out there who are healthy are probably saying to themselves, I don't really need health insurance. I'm not going to pay for that.
Yeah,
I'll pay the fee instead.
And I think that's unfortunately one of the biggest mistakes anybody can make when they're young. I think some young people take it for granted, right, because the Affordable Care Act has allowed parents to keep their children on their insurance policies till they're 26. As a result, a lot of parents have done that because the parents realize how important it is. Kids, you know, what I would say is about a young person, again, it's just think about your future. If you're going into employment, odds are you're going to be able to access insurance, and you will probably buy insurance. It's for the people who are not necessarily going into a large employer and they're with a small business or something. Those are the folks that I say to, I think about most often, and just really think about how important it is to be secure for your future. Just think about it. Think about how concerned you are about every other bill in your life, right? Your utility bill. How people react when the utility bill goes up by $5. People get more concerned about the utility bills than the security for their health.
Well, if you don't,
they need to reprioritize.
If you don't have your health, what do you have?
That's correct. And you just need to prioritize your expenditures, I think.
You say don't fix it if it isn't broken.
That's right. That's right. And so what I mean by that is, well, I mean several things by that. But first of all, you know, if you're okay and if you're taking care of your health and you're insured, you know, the system will work for you. Preventive care is now available to people. Go get your preventive health care. One thing that insurance does nowadays that it didn't do before is encourages people to actually take charge of their own health and get those cholesterol screenings, those high blood pressure screenings, those yearly physicals that you need. And if you stay healthy and you get paid to do that, sort of those things are covered, chances are you'll stay healthier and the cost of health care will stay down.
No, can I just get the minimum?
What do you mean, minimum coverage?
What
or
if,
minimum?
yeah, if you only want the minimum coverage?
You can. So there are plans right now, and there will be a plan in the Affordable Care Act, and I tend to think that some of the younger, young healthy invincibles, the young invincibles we call them, will migrate towards these plans that we call the catastrophic plans. And these are plans that are cheap in terms of expenditure, out-of-pocket premiums, but they are catastrophic. They will cover the high dollar expenditures, but they won't necessarily have the meat of an insurance policy for somebody who goes and gets care a lot.
Now, people do want health insurance, but some of them just can't afford it.
Yeah.
What should they do?
Right, so we have a population in our state, we have about, I don't know, 100,000 people that we think might even be eligible for Medicaid under the Affordable Care Act when it expands. So we have a lot of people who are lower income. Those people, thankfully, the Affordable Care Act does expand the eligibility level for Medicaid. So a lot of people who wouldn't be able to buy a policy in the marketplace can get on Medicare right now, or Medicaid, excuse me, Medicaid. But for people who are of lower income and of income up to what we call about 400% of the federal poverty level, which is about $44,000 for a single person, they'll get help to buy their policy, and significant help for the premiums to reduce their out-of-pocket premium every month. In addition, if their income is below 250% of federal poverty, they'll also get help with co-pays, deductibles, those cost-sharing help.
So you really need to look at what's out there because you could qualify for some subsidies.
That's correct. You really could. And, you know, it does take some research, but in October, when open enrollment starts for the marketplace in Connecticut, there'll be a lot of help. You can get a broker to help you. You can go online. There's an online portal. I think a lot of people will go that route. But there will also be navigators and assisters, people who will be on the ground in the communities to help people one-to-one with assistance in enrolling. So there'll be all sorts of help to figure out what people are eligible for.
Well, what if someone makes too much money for Medicaid but still can't afford to buy insurance?
Well, depending on what the percentage of their income is, how much that the premium would cost them out of pocket, if it exceeds a certain percentage of their income, and it depends on their income they make, what percentage that income is, then they would be exempt from having to buy a policy. We hope that that doesn't happen very often, but there are a limited number of exemptions for people to not buy a policy.
So if they don't get the insurance, there is a fee, a fine
Yes,
that
there
have
is a penalty.
to pay.
Yeah, there is a penalty. So there is a penalty for not purchasing insurance. The whole idea behind the Affordable Care Act is everybody needs to participate. You know, if you want health care costs to go down, it can't just be the people that go to the doctor all the time that get insurance. The people who don't go have to buy too. Because if they don't buy when they're healthy, then the pool of people who's buying is only people who are what in insurance terms they would call riskier or sicker. So the cost would be higher. The insurance costs would continue to stay up. So the incentive to make people buy is what we call an individual mandate. And so if you don't buy, you will have to pay a penalty. And the only circumstance in which you don't have to pay a penalty, they're very rare circumstances, and they are only if the premium exceeds a very high percentage of your income.
There's so much more to know. Where should people go for information and
So
help?
people can come to our office for help. OHA has a toll-free number, and it's 1-866-466-4446. You can call us or visit us online at www.ct.gov, or excuse me, ct.gov/OHA. We speak both Spanish and English. We educate people about their health care rights. We are advocates, and we are here to help you.
That's right. Thank you all for watching.